Welcome to the gnpsir classes official channel. Professor Govind Narayan Purohit in this lecture explains the drugs acting on the urogenital system. Listen carefully till the end to learn all the drugs. Here are the contents. We will discuss diuretics, urinary acidifiers, urinary alkalizers, urinary antiseptics, H-bolics, and tocolytics. So first let us talk about diuretics. Diuretics are substances or medications that promote the production of urine by the kidneys. The clinical use of diuretics includes fluid retention and edema that occurs in heart failure, liver disease, and protein deficiency. They can also be used in drug overdosage, hypertension, and ascites. The diuretics can be classified into different types. 1. The osmotic diuretics, for example mannitol and glycerol. 2. Carbonic anhydrase inhibitors, example acetazolamide, methazolamide 3. Thiazide diuretics, examples hydrochlorothiazide, metolazone 0.4. Potassium-sparing diuretics, examples amiloride and triamterene 0.5. Aldosterone antagonists, examples spironolactone 0.6. Mercurial diuretics, examples calomel and mersalol 0.7. Loop diuretics, high ceiling, examples furosemide, bumethanide, tosamide, and H. Xanthine derivatives, examples theophylline, aminophylline, and caffeine. The category of diuretics, their examples, mechanism of action, and clinical uses are shown in the table. The osmotic diuretics increase urine flow by increasing the osmotic pressure in the renal tubules. The carbonic anhydrase inhibitors inhibit carbonic anhydrase and reduce bicarbonate reabsorption. The loop diuretics inhibit sodium-potassium chloride cotransporter in the loop of Henle. For a copy of this lecture, download the GNP Classes app by the link given above. 2. Urinary acidifiers. Urinary acidifiers are substances or medications used to lower the pH of urine, making it more acidic. The examples include sodium acid phosphate, ascorbic acid, and methionine. The uses of urinary acidifiers include 1. They enhance the antibacterial action of hexamine, penicillins, and tetracyclines in urinary tract infections, and 2. They help in dissolving struvite crystals in cats. 3. Urinary alkalizers. Urinary alkalizers are substances or medications used to increase the pH of urine, making it less acidic. Examples include sodium bicarbonate, sodium acetate, and sodium citrate. Urinary alkalizers enhance the antibacterial action of aminoglycosides in urinary tract infections and prevent sulfonamide-induced crystallia. 4. Urinary antiseptics. Urinary antiseptics are medications designed to prevent or treat infections in the urinary tract by inhibiting the growth of microorganisms. They are used for the treatment of lower urinary tract infections. Examples: nitrofurantoin, methenamine, nalidixic acid, calcium mandalate. 5. H-bolics or oxytocic agents. Ecbolics are substances or drugs that stimulate the uterus to contract and promote the expulsion of its contents. They are used in the treatment of uterine inertia, and also to induce parturition in horses. They should be used with care in ruminants, and their use is prohibited to increase uterine contractions if the cervix is closed. In horses, oxytocin and prostaglandins can cause colic and sweating, and thus small doses are recommended. Examples include oxytocin, ergot alkaloids, and prostaglandins. 6. Tocolytics. Tocolytics are medications used to suppress uterine contractions, primarily to delay preterm labor. The term comes from the Greek words tokos, childbirth, and lysis, loosening. They are suggested to relax the cervix. Examples are isoxsuprime, salbutamol, and terbutaline. This table shows the clinical use and dosage of various drugs acting on the genitourinary system in cattle, horses, and pigs. Potassium nitrate has been used as a diuretic in pigs, cattle, and horses. It is administered orally in doses up to 30 grams per animal daily. Yet, this should be carefully monitored as it can result in nitrate toxicity. Methenamine, mendelamine, has been typically administered orally to cows at a dosage of 1 gram per 10 kilograms of body weight for 7 consecutive days. It's important to ensure that the cow's urine is acidic for methenamine to be effective as a urinary antiseptic. However, methenamine should not be used in cases of renal insufficiency, severe hepatic impairment, or dehydration. Hope the information was useful. Thanks for watching. Like, comment, share, and subscribe GNP Sir Classes Official. Bye.